with Dr. David Barzilai.
Hello, I am a medical doctor and I am a longevity consultant. So I focus on evidence-based best practices, whether that's lifestyle medicine or it's precision health, which really means personalized, uh, optimal preventative medicine, and things that are sort of more in the emergent side coming from aging biology labs. So I also wear a few other hats. I'm a faculty and trustee at the Geneva College of Longevity Science. I'm a lecturer at Harvard Medical School. I'm an educator, and I frequently speak keynotes and panels around the world as an advocate for scaling longevity medicine, longevity science.
And what do you think aging will look like in 5 years?
So I think it's easier to answer directionally than exactly where we'll be in 5 minutes, for 5 years from now. 5 minutes, maybe we can handle, right? So what I would say is, in terms of the science, the aging biology, I think we're moving more and more towards having funding of geroscience. That is the greatest risk factor for passing away or developing from lung cancer is not smoking. It's aging. Same thing with we see the same exponential rise for many conditions, everything from diabetes to heart disease to dementia. So I see the science more and more focusing on the systems biology of what changes as we get older, as well as a prominent role for AI, very apropos for the Aging Code Summit. And I would say medically, we often focus too late. I mean, modern medicine is fabulous. I think it's at the core, but I think more of a focus both on preventative medicine, lifestyle medicine, which I think we should up the training and best practices for people worldwide. At the other end of the spectrum, it's precision medicine, really personalizing it based on knowing someone's data on an individual level, another AI issue. And then we're also going to be focusing more on things like wearables or other ways to track our biomarkers in real time, because I don't know about you, but typically most people come into their doctor once a year, maybe twice. They have a problem, they have a symptom. Wouldn't it be so much better if we had something silently, unobtrusively measuring in the background when something is moving in the wrong direction before you actually get sick, so we can do something about it. So we stop putting people on medications to lower blood glucose as the only course, but how do we prevent people from developing diabetes in the first place?
We also wanted to solve that problem from our position with our experts, right?
Absolutely. And it takes an ecosystem. That's something I appreciate of the work you and the many Aging Code Summit participants is all of us are working for a common goal of health span, which means not just living longer, but having higher quality of life and preventing disease when we can.
Yes, exactly. What do you see the biggest challenge in aging science right now?
I think one of the greatest challenges for aging science is a relative lack of funding. If you're talking about aging biology, the biology of aging, or geroscience, right now the division of aging biology, latest time I looked, about 0.7% of the entire NIH budget for the biology that is the basis for somewhere between 70 and 80% of chronic disease we have. That's partially because until recently we didn't appreciate how the systems biology, how we become vulnerable to age by virtue of age as a risk factor. We think it's just something that happens to us as we get older, but we're finding in animal models that we can mitigate hallmarks of aging or biological drivers of aging. They're living longer and healthier, and it's time to apply that to people. So I think a big part of the progression is having that be a focus. And I would say the other thing is sort of the having biomarkers of aging validated, because if we're to have good studies to see if these things work, we can't randomize kids to whether it's a diet or a fancy molecule, AI assisted plus or minus, and then just follow them for 40, 50 years, right? We need to have a way to tell when people in a reliable way are getting older. And we're at the beginning of that, but they aren't yet ready for prime time. And that's going to be really important.
Yeah, hopefully from the wearables, because wearable already tracking all the trajectory data. So we can take advantage from wearables and the logging informations with AI tools to develop all the tools in advance. Yeah.
I agree, and I think for them really to work, you see, we're getting real-time data,
Yeah.
so you can act without delay,
Uh-huh.
and it's much more granular. You know what I mean? It's multi-dimensional data,
Yes.
so we can use these AI algorithms to be able to say not just something works for the average Joe, but how about for you? You might not be the average Joe. So precision medicine is really about the right treatment at the right time for the right person, and wearables and other technologies that are not obtrusive. Eventually, you know, we can imagine little machines measuring things. Sensors is a new area of biology too. So I think it's all going to be part of this big data driving innovation and in a upward spiral.
Yes, for sure. What's one thing you wish more people understood about longevity?
I think one of the most important things is people tend to fall in these camps, kind of like a small minority who are ebulliently enthusiastic, that don't understand the science well, and at the other end, the great majority of people who are like, "Oh, that's snake oil. You know, we're like a car and we wear down." But as I was alluding to earlier, just taking one example, for rapamycin is a small molecule, and it's used already as an immunomodulator, but used in animal organisms, from anywhere from yeast to Drosophila fruit fly, nematode worms, mice, and now even some preliminary work, at least as far as health span in non-human primate. It seems to extend our health based on these drivers of aging. So I think the most important, I think it really comes down to having education that the biology of aging can be modified, and we should be making strides as a society to fund it, and also have the sort of regulatory reforms that the Alliance for Longevity Initiatives and other organizations are trying to have the funding and conducive environment for biotech to promote these technologies and succeed.
Yeah, I agree with, especially Dr. David is really trying to spread out and educate many public people to understand longevity science and medicine. I really appreciate your work to innovate it for longevity, better understanding for public. Yeah, I really
Thank you. That's
appreciate.
very sweet. And I appreciate the great public service you're doing being here right now, because it's really going to take a village bringing us to 21st century, as Matt Caberline would say, or medicine 3.0, as Peter Attia, or as I would say, good medicine. Let's fix our problems before they become problems.